I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
Coronavirus.
Bismillahirrahmanirrahim. Okay. Assalamualaikum warahmatullahi ta'ala wabarakatuh, and a very good afternoon to all of the members who joined this important and influential meeting. Before we further our discussion, so I'd like to introduce our panel, even though all of us know each other. I introduce myself. Okay, I'm Muhammad Salim, currently serve as a Prime Minister of Malaysia. And our discussion is going to be, of course, regarding the crisis of COVID-19 Malaysia is facing. So, yeah, I'd like to introduce Professor Dr. Shazana from the Ministry of Health, serve as a Deputy Minister. Yes, Shazana.
Hi, my name is Nur Shazana binti Muhammad Rafi. I am the Deputy Minister of Health Malaysia, and thank you for letting me participate in this meeting for us to help the country to be better. Thank you.
And next we have a special guest from the Ministry of Finance representing a panel of economists in Malaysia. So yeah, Dr. Shahira, please.
Assalamualaikum. My name is Nurul Shahira binti Abdul Rahman from Ministry of Finance. So thank you for having me today.
Okay, next we have our IGP, Inspector General of Police Malaysia, Dato Kumizi. So yeah, Dato.
Okay, so I'm Homizu, and you can just call me Dr. Ho. I'm the Inspector General of the Royal Police Malaysia. So it's my honor to fight with you in this crisis.
Okay, so now we, as I mentioned earlier, this is going to be a confidential meeting regarding the COVID-19 crisis that we are facing. As I announced on 16 March, we're going to have a special press conference for the current situation, as we didn't have any vaccination for this COVID-19. So we are going to implement the lockdown. So yeah, I'm declaring now, Malaysia also going to impose or implement the lockdown. Are we ready for the lockdown? I would like to ask what the suggestion from the KKM representative, Dr. Shazana.
Thank you for considering the option of doing the partial lockdown or the lockdown. I think that we should see this issue based on a long-term condition. If you look the other foreign country like China and Italy, they made a wrong step by not shutting down their country as soon as possible when they know the cases in their country is rising up. So it took them less than 2 weeks for their folk to actually get infected. Their graph of cases is getting higher drastically without the government concern. So if we make the same mistake like them, I think our country will end up having a lot of cases like the foreign country that I told you before. So as far as you may know, Malaysia, as for today, we are having a total cases of 238 people without no death. I think for now, it may be a good news to hear that we have no death. But as far as I'm concerned, we're having trouble with the people who made a big group meeting, like the religious cluster at Sri Petaling. It involved thousands of people around the world. So half of the people who are joining the cluster at Sri Petaling, religious at Sri Petaling involving thousands of people, and half of them is from our country, which is in Malaysia. So the rate of affected people from the cluster that I have told you, it is average. It is more than 20 people a day who get infected. So now I am only talking about the cluster. We do not know about the subcluster. So if we still let them roaming around there, out at the road and at the works or even at the school, I think it will be a huge mistake for our frontliners and even the police. So what do you think, Dr. Tan Sri Mizi?
So from the view of the police, all I want is to make sure that the police as the frontliners will get the job done in healthy. So I will support the total lockdown because it's a clear message to all the people that you are not allowed to go out from your home. We don't need to argue with the people that should you go out, like, do you have the letter, and maybe let our police officer in danger. It's a easier way due to the human power. The police officer is not enough to control the country in partial lockdown. So, what do you think, Prof. Shahira?
Okay. I'm also worried that the pandemic issue is expected to hit Malaysia badly, as we've seen and heard. This virus is very dangerous as it can lead to death. So I understand why Ministry of Health want to propose a total lockdown on Malaysia as the outbreak is very rapid and widespread. But in my view, as an economist, we cannot make the rush decision by running a total lockdown system because we need to consider other aspects, and one of the aspects is Malaysian economy, whether we capable or not carrying out this total lockdown. First of all, we must aware that domestic business and industry also donate to the increment of Malaysian economy. As we know, many of our local and businesses rely heavily on China industrial hub. If we ask a small premise or even a big premise, the majority expect and depends on the good from China. So the pandemic appeared in China and several other countries before Malaysia, right? So China chose for a total lockdown to curb this outbreak. That means all business and all manufacturer also delivery were shut down, which means the business in Malaysia also were left pending. So through China lockdown, it does affect our economy before. So if Malaysia take the same path, it will contribute to the country economic downturn. China having their total lockdown for about 17 days, which is it's quite a long time. So if we choose a total lockdown also, we cannot predict how long Malaysia gonna face the total lockdown until this issue to vanish. And from what Dr. Ho say, Dr. Datuk Sri Ho say that they support total lockdown because it's easier for them to control the outbreak. I would like to share what happened in Ireland. Ireland is a small country and one of the country that take an early precautionary step. They also had announced to choose a total lockdown for the way to curb the outbreak. However, lack of awareness among their netizen lead to more cases in Ireland. Even though they have a small population, but the cases of COVID-19 is huge, which I would like to share. The total cases happened in Ireland about 14,758 and death is 571 and the number that recovered is only 77 cases. So based on what I say about Ireland, what is your opinion, Tan Sri Salim?
Okay, thank you first of all of you to share your concern. SKKM requested to implement the fully lockdown as IGP also support the suggestion, but it seems like economists suggested to do a partial lockdown. As a few of you already mentioned about China's and everything, I concern, as I know and as we discussed, even China also have made a total lockdown for several districts and several specific areas. I think, of course, large number of part of China was locked down, but still there is maybe a few more essential sectors was operated, like ventilator productions, the food production, because at the same time we have to concern about the life of millions of people. At the same time, we have to make sure the capacity of the citizens to continue their normal daily life for their basic needs, like foods and water supplies. So, and some of the countries like India, they announced a lockdown process, but I think the miscommunication do happen, and people die from corona. They have the number of people who die from corona. At the same time, they face another crisis, die for hunger, because they think our Malaysia also have more than half of the population. We are still under M40 and B40. So I'm just worried and concerned about their current situation, how they're going to face this crisis rather than the crisis of corona as we concern. And I don't want the crisis of finance by them to be happened. So I think we can implement maybe partial lockdown, but I still concerned. How do you think as a Minister of Health?
Yeah, I think if we make partially or a lockdown at our country, I think what we have to do is firstly, we have to make sure that they have to get a social distance by having a distance of 1 meter difference between from one to another. For as you may concern about the people who have to work, I think that they can actually work from home. They can make their meeting while video meeting, I think, because I think that if we still let them working as usual, I think they will have a new clusters maybe at their work, or even at the most during the Friday's prayer. Not to talk about the people who are roaming outside, for example, at the airport. I think if we still let them roaming around, like there's nothing happen without the virus. If they have one people with a positively infected, the virus will infect to at least 10 people around the positive cases. If they touch the same part as the positive patient have already touched, they will get infected, and we will have to spend a lot of money due to the frontliner suit and for the quarantine space. Based on that, it will suffer our economy too. We still have to make a lockdown for us to ensure that the risk is lower down. We can lower down the risk, and for the police, they can operate like usual without concerning about the people who are roaming outside at the road. That's what I think.
So Dr. Mentioned that you still insist to implementation for the total lockdown, is it?
Yeah, because it will help us to not make the graph rise up drastically.
Okay, on my concern, because we have several countries, they have a far more number of cases of COVID-19 and still in the process of partial lockdown. For example, South Korea, they didn't even do partial lockdown. I think we still can implement the lockdown by partially. Okay, as I mentioned, South Korea didn't implement yet. I agree to the part of a total lockdown, but we have to see the green zone areas also, because several areas doesn't have any cases yet. We can do fully lockdown for the specific location, because we have to ensure the country's economy and to run at the same time. The first concern should be about the life of our citizens. I think as Dr. Mizi also mentioned just now, they have a lack of forces of police. I already discussed with the Minister of Defense. They do agree to combine with the police forces to implementation for the partial lockdown. So I think the number of the forces we have now, I think sure enough, okay, to implementation for the partial lockdown, Dr. Mizi. So what do you think, Mizi?
Yes, if the army can help, it should be a happy thing. As I know, all the medical resource like face mask and the test kit are imported from either China or South Korea. Do we really have the enough those medical things to keep our patients alive? And also, PM, you're concerning the Indians from the lower class die because of hunger. What I can suggest is we can give the allowance to the delivery company. By doing so, only the people from the delivery company can go out from the home and deliver all the groceries in the urban area. What we can do in the rural area, we just try to give them more money to extend the service to there. Because what Dr. Shahjana said, there are many people from safeguarding program and they are hiding. We don't know whether they are positive or not. And we are facing the problem that we cannot find them. Total lockdown may be the effective way to solve this.
What do you think, Prof. Shaira?
First of all, I respect what Health of Ministry requesting for a total lockdown. But from what I know, it requires a lot of time for us to actually vanish the outbreak. I know the virus, the COVID-19 virus spread very fast, but we had to aware that for us to identify whether we are positive COVID or not, it require about a week, and we need to quarantine ourselves for about another 2 weeks, and it close to a month. So I would like to share with you what is the opinions from Governor of Bank Negara Malaysia. Datuk Nur Syamsiah Muhammad Yunus. It said that healthcare is a short term when a vaccine. So after we finally know the vaccine, the country economy will recover and rise. Yes, it's true. But she acknowledged that the country economy may collapse in the first half of 2020. But they will try to recover in the second half of 2020. What Datuk Nur Syamsiah Muhammad Yunus predict is for a short term of COVID-19, and gross domestic product GDP had record that if this pandemic issue going for a long term, our economy might drop to -3. So because of all the premise and business are closed down. So we also had to aware that when premise, business, company, all the sector industry are closed down, the owner of the business itself might have an issue where they need to reduce worker because they might be drop in their company finance issue. So international level organization also say that they expect that this COVID-19 crisis might increase the unemployment, especially in the service sector. So based on what said by the Malaysian head of art, Datuk Seri Dr. Muhammad Uzair Madhidin said, last year we already had about 3.2% of unemployment, which means about 510,000 of people that are unemployed. If we choose to be a total lockdown, we don't know how long Malaysia gonna face a total lockdown. China itself have about 70 days. So if we must bear for about 70 days without any industry or sector going on, we don't have a rolling money to support all the netizens that have no money to support their family. But we need to think, how about the person that depends on their restaurant, their small store, selling kuih, how they survive during this pandemic. We've closed down, that affect our economy. We could not afford to support the whole population of Malaysia. People with no shelter where they spend their life on the street, we cannot let them stay on the street. We need to provide a shelter during this outbreak. So that require a lot of money. If we cannot open important industry, which means we had no rolling money, we cannot provide a fund or help, like economic stimulus package or so on. So if we choose to do a partial lockdown, we just open several industry that are important. Um, we economists are not, we don't want to make a profit. We just want to have something to back our rolling money. So if there is a rolling money going on, Ministry of Finance would be able to provide economic stimulus package where we hope we help those who in need to survive during this pandemic. So we also might consider on giving funds for business owner that had to pause their business according to terms and conditions. So what my opinion, I thought that my suggestion to confront this pandemic outbreak is we do a partial lockdown, but with maximum limited access. Just a few industry and premise open with a condition that the law will be more stricter and tighter. So the company that had pass to open, they need to follow what the guideline given by KKM. So I think if we do like that, even after this COVID-19 outbreak is vanished, our economy can go back to normal. So that is my opinion.
So yeah, thank you, Dr. Shahida, Prof. So maybe I agree partially, maybe a few, I think half of the suggestion by the KKM to do the lockdown as requested, and also even Dr. Mizi for the total lockdown. So let me clear a few things. If we do a total lockdown, we might face economic crisis too, as we might face a shortage of food or any other essential supplies, which may lead to another crisis also. Okay, in the early, might be around April, we are estimated to have around 6,000 cases of COVID-19 if we do a partial lockdown or even lockdown. You see, maybe we do the lockdown because the numbers of the patient is going to be unpredictable, because we are in the situation where predictable. There is a lot of factors affecting the transmission. So we estimated 6,000 patients, and I think we still have a large capacity and capability to control and curb and prevent this COVID-19 from spreading. I'm pretty sure, even though we made a partial lockdown, we can implement a lot of restriction and movement control order, and including the involvement of armed forces, army. Okay, as I mentioned, we discussed with the ministry. So, and I think, yeah, and we have faced the economic crisis in 2009 and also 1997 to 1998 also. At that time, we didn't face much something like this. But 2019, I think, worst crisis. Our economy down to negative 6%, and now we get the estimation by the Malaysian Institute of Research, Economy Research. They mentioned we might face economy shot to negative 4%. So that's why we are in the process to developing the economy stimulus package, and we are already requested from the China and also several neighboring countries and our local pharmacies and ventilator provider to do a lot of these are all the PPE, the personal equipments, all the medicine facilities, and those things. So I think we pretty much prepared to face even lockdown or partial lockdown. But for the comfortable and also the concern for the people itself, I might be choose to implement the partial lockdown. Another thing that if we implement the total lockdown, we might face another cluster, which is panic buying. To control over the panic buying and also the panic among the citizens, I think that's another worst case might be happen, right? So what we have been yesterday in TBS, around 10,000 people are gathering in all over the nation, bus station and also the public transport platforms. So we don't want that to be happen. I think KKM might be convinced by what I try to say. Dr. Shazana, are you convinced what I try to say? Our current situation is it?
Yeah. A resident of Malaysia, we have to actually follow the rules that have been given by the government, and I think we still have to do the social distancing. We have to for the economy, they can open their markets, but it will they have to shorten up their office hours. So I think it is good. Yeah.
What do you think, Dr. Izzy?
What I'm concerned is the police officer. Well, we keep the safety and the healthy of them. So you said that you can let the army help us. So my problem is solved. I think the problem will caused by the lockdown, whether it's total or partial, is the petty buying. What we can do is release the message gradually. First, we just say it's only 40 days to let them accept it softly. Then we will let the lockdown more and more becomes the total lockdown. What do you think?
As the frontliners' health and the safety are concerned, for that we have a special task force to ensure the police or the armed force, the army, to have a special training towards all the how to deal with all the citizens and how to conduct restricted movement order. So I think, and that part, I think we have no issues on that. And we should convey the message for the partial lockdown to prevent the panic buying, as you said, prove to them that they can still access to all the basics need for them. I think we just first for the 14 days, we announce for the partial lockdown first. Then the worst case scenario, we might face a lot of drastic increase in the cases as a concern about the KKM. We might implement the total or more strict lockdown in the specific outbreak, which have a large number of cases in it. Do you agree on that, Dr. Mizi?
Yes.
So I think we have to agree that we still have a total lockdown for the specific places and also partial lockdown for the green zones areas to avoid any cluster or subcluster. And maybe for Shahira, Dr. Shahira, and we move towards the economy package stimulus, right? So yeah, I think this is the best solution by now we have. So is there any objections or suggestion you can add up, Dr. Shahira?
I quite agree with what Tan Sri Salim said, that we move to partial lockdown and total lockdown. But first of all, we first before whatever we're doing this, we Malaysian, this is the first time we confront with this crisis. So we must be aware on how we to convey the message, how we to spread the awareness to all the netizens so that they're well prepared, they are not panic, so that there will be no panic buying. So if we say that partial lockdown, we need to say that we need to convey the message clearly, and we need a cooperation from KKM and also from from Datuk Ho to prevent netizens from one state to another state. Yeah. So
I think as all of us agree to this mutual understanding and also the vision, by now we are first implementing the first stage of the partial lockdown. Then further we should enforce it for any specific location for the total lockdown if we need so. So thank you so much for your cooperation and as a responsible person, and I'm really proud to have all the frontliners and the ministry, the members here. We will solve this together, inshallah. So, Assalamu alaikum and thank you so much.
Wa alaikum salam and thank you.